Hello, welcome back to the Washington Health System Friday video series, where we attempt to update you about what's going on within our organization, but what's going on in the community around us. My name's Brooke Ward. I'm the President and CEO of the Washington Health System. My honor to be back with you today. First topic I wanted to talk about was welcoming back visitors. Now, as most of you know, last Friday, our counties around us turned green, which loosens up the restrictions related to COVID-19. And as part of that, we changed our visitor policy. So starting last Friday at both of our hospitals, between the hours of 9 a.m. and 6 p.m., we will be allowing one visitor per patient to come in and visit. The exception to this, of course, would be in the labor delivery suite, where a support person can stay with a laboring mother around the clock. Beyond that, though, it would be restricted to one person. We are asking when you come in, you'd be required to wear a face mask. This visiting policy would apply to inpatients, surgical patients, the ED patients, ambulatory care, outpatient procedures, and diagnostic testing. As part of that, you might need to know where to come in, and we still have restrictions on our entrances. So if you're going to either one of our hospitals and you're going to see or visit a patient in the emergency department, of course, you'd go to the emergency department doors. If you're going to the main hospital, at either one of our locations, you go to the second floor lobby entrance. If you're a cancer center patient, then you would go to the G level at the Washington Hospital and you could enter there. Otherwise, all entrances and doors remain locked at this point as we restrict access to visitors to the building. Now, we just received yesterday across the state of Pennsylvania a new executive order, which basically requires any patient and visitor coming into a hospital in the state to continue to wear a mask. That's been our policy for well over a month at this point, but at this point now, that's a requirement by law in the state. But when you show up to one of our entrances, you'll be greeted. You're going to be reminded to continue to social distance, wear your mask through the building. We're going to ask you to perform hand hygiene with hand sanitizer on the spot. That way, when you're coming into the building, you have clean hands. And then we'll go over the restrictions. In addition to limiting it to one person, we're asking you to go directly to the room of the person you're going to visit and stay in that room. The only other locations we'd like you to go to would be the cafeteria if you need some food, or to the gift shop. Otherwise, if you need to stretch your legs, we'd ask you to go outside and do that. We don't want people walking the halls unnecessarily, exposing themselves or others potentially. Our outpatient physician offices, their visitor policy and process has not changed. And if you have any questions, you can contact them immediately. For more information about our visitor policy, you can visit our website that we'll include in a link as part of this video. Next topic I wanted to talk about was basically returning back to normal with the opening of our services. And as of this last Monday, June 5th, every one of our services are open. And so as we continue to try and slowly ramp up carefully, we've been doing that in a very cautious way. But as of our last video now, on June 1st, the Children's Therapy Center in Washington location opened, along with Cecil Family Medicine and Cecil Diagnostics. On June 5th, our School of Nursing classrooms opened. So we had School of Nursing students doing clinical rotations here in simulation, but they were doing classroom virtually up until June 5th. June 8th, this last Monday, the Wilfred R. Cameron Center opened. It was our last facility that wasn't open. It is open at this point at 50% capacity. The only things not functioning there would be the saunas and the towel service. And Spa Harmony is open at this point as well. And then lastly, coming up June 15th, we are going to gladly welcome back our volunteers. So we're going to have volunteers at the Washington Hospital working in the gift shop, the front desk, surgical services, and the Women's Center. And down at the Washington Health System Green, we'll have them at Cherry Door, Escort, and the lobby shop. And we're looking forward to seeing our friends and having them back with us. Now, the next topic I want to talk about was not putting your health on hold. And we've gotten lots of physicians who have commented that they've ordered diagnostic lab and radiology procedures on patients and they're not getting them done. There's some concern by patients that by coming in, they put themselves at the risk. And our physicians, frankly, are more concerned that you're putting yourself at risk by delaying that care. So don't put your health on hold. Feel free to come in. Our facilities are safe. Frankly, they're safer than any retail store you're going to in the community for groceries and other things, and we're happy to have you. Changing subjects, last Friday, June 5th, we had our 48th Family Medicine residency graduation. We had 7 graduates from the residency program. We had 2 fellows graduate as well in palliative care and geriatric care. That makes 296 graduates since the program started in the early 1970s. Very excited to attend their graduation. We had a ceremony in our community room. We allowed the graduates to attend, of course. They got to bring one loved one or family member with them, and then we had a few faculty members in the room. And then otherwise, we broadcast that virtually across the internet so folks all over the world could watch their graduation. So very excited, happy to wish them best luck in their career, congratulate them for their graduation. And while I'm at it, I want to make sure I congratulate all the local high school and college grads from the class of 2020. Last thing I wanted to comment on briefly would be sort of what's going on in our environment around us. And the Washington Health System, I want you to know, is committed to providing great patient care to every single one of our patients, regardless of their race, ethnicity, nationality, language, gender identity, sexual orientation, social economic status, age, religion, physical and mental ability. We don't and we won't tolerate any discrimination in any form. Now, our country, of course, is going through a moment of civil unrest, and I want to redeclare for our team members, our patient, and our community that the Washington Health System pledges to uphold our corporate values, and those are respect, compassion, integrity, community commitment, continuous improvement, communication, and putting our patients and families first in everything we do. As a health system, we endeavor, of course, to prevent illness, cure disease, eliminate illnesses, relieve pain, improve overall quality of human life. But the quality of life goes far beyond what we can do in medical care. We understand that, we recognize that. So we know we have to listen, learn, and continue to contribute to making our community healthier and safer for everyone. And we are committed to that. So that's the update for our Friday video. I hope you found it useful and informational. If you like these kind of updates, you can also get information by looking at our Washington Health System magazine. We mail that out every quarter. It's due to be scheduled mailed next July, here in a few weeks. If you already receive it, great. If you don't, you can go to our website. It's whs.org/connections to sign up to have it mailed to your house. And of course, we put digital copies on our website if you prefer that version. That's our updates. I hope you found it useful. We're going to have another video on June 26th. Until then, stay safe and thank you for watching.